A very good afternoon, everyone. Thank you so much for taking time out, coming here and joining us for this panel discussion. We have amongst us, I would like to call them champions for the cause of ultra poverty. Really honored to be moderating this session. I'll first like to invite Shri R Subrahmanyam, Secretary, Ministry of Social Justice and Empowerment, to give us his keynote for the panel.
Friends, it's good to be back in an auditorium and speaking to people. I think for 2 years, it's all virtual and you just don't know whether you are really speaking to a wall or to a person. And certainly, even if it is a person, how well we are able to get across. Anyway, so bad things last. So good thing is that we are all here, and this subject, bringing it to the center stage, is something which I have really missed for a long time, because I think the entire discourse has undergone change in this country, across the world, probably. That the poverty no longer attracted the bright young minds as it used to be. I think I would say that the poverty as a subject has probably enriched a large number of academicians, produced probably the large number of PhDs, and brought in loads of academic work. So I hope that it will continue to be, because I think the progress of any society can be measured only by the last man in the line. If the last man in the line is struggling, then it doesn't matter how well you how much of growth rate that you have got, what is your GDP, whether you are number 1, number 2, number 3, it just doesn't matter. So primarily, we are looking at poverty as an inclusive phenomena in the growth process. And I strongly believe that any growth process which is not inclusive is not a growth process, because the entire growth process is supposed to be meant for the people who are to be lifted up. So this Charcha, and thanks to Nudge and Gates Foundation and all of you, World Bank here, for bringing this topic back into the circulation. I'm happy to see so many young, bright faces back here again. Friends, of course, we have traveled a long distance. We are not, 10 years back, and now if you see, I see myself tremendous amount of change. There used to be a time when we used to say, islands of prosperity in a sea of poverty. Things have changed. Now I see that there is fair amount of aspirations, people who want to progress, and then there are islands of poverty which require attention. So that's where I think this concept of an ultra poor strategy has really attracted, because I think that's exactly what is required, because you require to look at who are the people who are left out of this developmental process, and large number of them are still, and then look at what is it that we can come out with the solutions. And I really see, and now I'm just digging back into my 3 decades of experience looking at poverty. I think it's just 2 strategies which has made the difference, from where we are today and where we were about 3-4 decades back. It's not the government investments. It is the ability of the poor to come together and then realize a new identity, which they thought was not there. And then coming together and then understanding that their strength is their numbers, and their strength is their aspirations. Their strength is to work as a group. And the self-help group movement which has come, which has started in different parts, Bihar, Andhra, Tamil Nadu, has actually helped in bringing together a new concept in development. And of course, it is nudged by the government machinery. But then the point is that this is one program where the heroes of the entire strategy has been the poorest. It is not that, it's not the government which says that, okay, I am the Mai Baap, so you look up to me and I'll give you what you want. It is not, it has not rained subsidies. It just basically told the people that you have the power, once you are together, you can create a social capital which will be, which you can leverage from the financial system. Today we have seen SHGs, 8 million is the number that has been told, is that they are substantial stakeholders in the financial system in the country. Institutions like Srinidhi of Telangana or Andhra, they are able to compete with any of the banks in terms of their the way they do their business, the lowest NPA rates, probably anywhere in the country. So they have turned a new chapter in their lives and in the lives of this country. I have seen myself, the self-help group, the poor SC women who struggle through daily wage, completely landless, probably houseless. But thanks to the SHG movement, they sent their children to school, they studied engineering, they have gone to US, and these women have, very proudly went to US, to visit their children. And then just imagine the sort of change that it has brought about. I mean, completely unthinkable in one generation. So this organization of poor is what has actually done a tremendous amount of change in the poverty scenario in this country. The second thing that has done is a very high-intensive government investment program, that is the National Rural Employment Guarantee Program, which has said that, okay, nobody should go hungry. You have no work, there is a work here. And the work is where you live. And the work is where where your assets are. A work is where your village is. So it has brought together crores of people into a productive workforce. And today, many of these people, in fact, I would say that, when the large-scale exodus took place from the cities to the rural areas during the COVID shutdown, programs like NREGA have really sort of were the things which sustained the rural economy from a complete collapse. So there is certain amount of hope that has been created. Of course, NREGA can always be improved. Any program can always be improved. But the point is that today we have in place an instrument with which the ultra poor can rely upon to bring them out of the acute distress. Friends, I said that we have islands of poverty. What are these islands of poverty? And what is that we are doing about it? And what is the way forward? I think, I'm sure this is what the purpose of this entire charcha is. So, fortunately or unfortunately, me and Jaya probably look at, the poorest, households who are left out of the developmental story. The scheduled castes, not all the scheduled castes. Now there is a demand for categorization among the scheduled castes because some of them have really sort of come up very well. But then there are islands of poverty. Then we have, of course, tribals. Again, fortunately, there is no demand for categorization, but I think there's substantial differences in the growth process. There are some places where they have really come up. Again, you look at the tribal areas of Andhra, and thanks to education, they have all come up. There's so much of change in the tribal areas. But then you go back to Jharkhand, probably there's a lot more to be done. So there is a geographical pockets also in this. The SECC data, I'm sure all of you are erudite. You have all, I'm sure the people sitting here know a lot about poverty. They would have read a lot about poverty. SECC data, which looks at multidimensional poverty, looks at deprivation points. So there are, households which are more than 3 deprivation points are close to about 1 crore, close to about 1 crore. And despite all the criticism against the SECC socioeconomic caste census, I think it's one of the best efforts made, extensive effort that has been made to identify and rate the poverty based on very well identified indicators. I don't know whether SECC must have produced some more PhDs. I'm sure, poverty has always produced PhDs. So probably it would, if it has not, then I'm sure it will. Because there's so much of data now. We have so much of data to analyze, to understand, to look at various dimensions of poverty. So we have a fair amount of data, and that is multidimensional. It's a purely multidimensional. We are not looking at $1.90 definition at all, because I don't think income, defining poverty by income limits is, I think, completely out of circulation, here at least. So we are looking at the SC and ST households which are having substantial amount of deprivation still. And they are about 1 crore, that is 10 million. That's in 2011. Then we have the denotified tribes, the nomadic tribes, semi-nomadic tribes. On this, there is absolutely no information with anybody. Not even with us. We are supposed to be taking care of them, by the way. We don't even know anything about it, unfortunately. Because they have never been properly enumerated. Whenever enumeration teams go, they are not there. They are somewhere else. And by the time they come back, the enumeration team is gone. Fortunately, I think they are not substantial in numbers. But still they are the most deprived sections who have no hearth, no place, and then they move from place to place. We need to look at what is it that we can do to address their issues. Then friends, we have destitutes and beggars. Now, these are actually not small in number. They are also substantial numbers. Only nobody is bothered about them. You see, the surveys they go to a house. If you have no house, where will you go? That is exactly what happened. Large number of destitutes are out of all this survey, even SECC also. So we need to look at the destitutes and the beggars as one category which requires a separate strategy. Then we have transgenders. Now this is another category. I realize that this is one section which gets completely left out even in the poverty discourse. Just because of a gender discrimination, just because they are thrown out of the house, just because they are the most exploited, just because they have no access to any education, because they are on the streets begging, I think this is one very vulnerable group, extremely vulnerable groups, sexually exploited. So, friends, I have defined some pockets. I'm sure this erudite group will define more pockets. Definition of a pocket of poverty is not good enough. That's what I tell all my PhD friends, that it's not good enough to do a beautiful analysis of the poverty. You have to come up with solutions. Any research which studies a particular problem is valuable because it is going to sensitize somebody. But it will be very useful if the researcher himself comes out with some solutions. I don't even know which researcher has suggested the SHG as a solution for poverty, but then it worked. So, my call to all of you here is that can we really look at these very, very different, desperate, sections of people, of the society who are out of the development process, who need to come into the development process, who are aspirational also, but then somebody has to really work with them. The SHG as a concept has not been able to work with them. because SHG requires, homogeneous, you have to live homogeneous, it has to be a homogeneous group, they should be physically contiguous. Probably we have to look at something else, or we have to look at a modified form of self-help groups. So we need to establish their identity. We need to give them confidence that there's somebody here to look at them. You require somebody, a team of people who will sit with them and then look at their livelihoods and then come out with a livelihood plans. I think the work is cut out for all of you. I mean, large number of young faces I see in this auditorium. So I'm sure your task is cut out to really look at these people with a discerning eye and then come out with solutions which are workable. I don't want to venture into a solution. We are working on certain solutions, but I'm not sure whether those solutions are the best. I'm sure when academicians, social activists, people who are working in the field verify this, probably we'll get better answers. But our faith has been on three things. Can we empower them educationally? Because education is a passport for them to fly. I'm not talking about flying to US, but I think fly out of this current, current state of deprivation. A lot of good experiments have happened in education. I want to just quote, Social Welfare Residential School Society of Andhra Pradesh and Telangana, where it has completely transformed lakhs of people into highly productive individuals. It is not any school. It is the best school in that particular district, and it has given seats to the poorest. So where do you get this, the best for the poorest anywhere else? I don't know. We must find, such solutions happening elsewhere. Education has been our most important investment. We invest a lot on making education affordable, providing access for the poorest to the best. Poorest to the best. That is our slogan. And then look at how we can improve their skills. And once they have education and skill, I think nothing can stop them. I mean, of course, largely, I'm making a general statement, but they are equipped to face the world. Then second thing we do is the social empowerment. I think there's so much of discrimination in this country even now, with all the plethora of legislations which are supposed to wipe out all types of untouchability and atrocities, but still there are substantial number. But our task is to see how we can implement these laws well. Every law is good. There's nothing wrong with the law, because so much of thinking would have gone in. Parliament would have debated before the law is passed. But how do you implement that? That's where we are really focusing. How can we socially empower them to come out and then occupy their space in the country? Economic empowerment, of course, is essential. And because without economic empowerment, your dreams will remain dreams. Once you are economically empowered, you can translate your dreams into reality. Then we are looking at the health. I think that's a very, very important, because I have seen with my own eyes how people slip from a reasonably okay economic position to a complete destitution because of the ill health of one person in the house. They lost their lands, they lost their jobs, they lost their cattle. So how do we provide a sufficient health support for the poor? Pradhan Mantri Jan Arogya Yojana, as they call it, as Ayushman Bharat, has been one step forward. I'm sure it needs to further expand, it needs to go deeper, provide greater facility. I'm sure we are on the track, but then somebody, some people like you should study and then come back and tell us as to what is it that you can do better as far as the health security is concerned. So health and nutrition also. With the entire investment on Anganwadi system, the ICDS has been one of the biggest investments that government has made. And I'm not 100% sure how it gets translated into outcomes at the field level. Of course, we publish every year data on how the nutritional standard is. It is improving. But how do we ensure that in these pockets of poverty, we make these institutions function? Because that's where they are the weakest and that's where they're needed most. So these are all the challenges before us, and seeing all of you here, youngsters and experts from various things, people who have devoted lifetime and studying these problems for a long time, I'm sure it gives me a lot of hope and also confidence that we'll find solutions, like we found solutions in the self-help groups. Thank you very much, and I look forward.
Thank you, sir, for so clearly articulating why it is important for us to look at ultra poverty as a problem statement that's very different from the nature of poverty that we have dealt with over the last couple of decades. You refer to them as islands of poverty, very apt. You also spent sufficient amount of time talking about the different categories of the ultra poor or the poorest of the poor. Just the categorization and the definition, as you very well put, is the first step towards targeting them. And you also spent time talking about the things that we need to do to bring them out of ultra poverty: education, social empowerment, economic empowerment, and health. Very, very inspiring, and you called out to those present here to come and contribute to this cause. On that note, thank you so much for your time. Thank you for the keynote, sir. I'd like to move to the panel discussion. Like Subramanyam sir just articulated, ultra poverty is still a very stubborn challenge in the country. For many, many islands of such poverty, there aren't really clear definitions, there aren't really clear program designs or interventions. But that's the role that we as development practitioners have to play. In the last decade, we have progressed a lot as a country. According to the Oxford Poverty and Human Development Initiative, we have halved poverty in the country from 55 to 28%. Has that done anything, this progress, has that done anything for the ultra poor? That's one of those questions that we need to answer. It's very hard to disagree that there are poorest of the poor amongst us who are getting left behind despite all of this progress. Why focus on ultra poverty? Because this problem statement in India is very large. Whichever data set that you might want to look at, whether it is the global multi-dimensional poverty index, which says 27% are extremely poor, or the ACCC data, as sir pointed out, or the World Poverty Clock, there are millions of people, the size of which is not seen across any of the countries that we see, barring probably Nigeria. Size of the problem statement itself necessitates that we focus on ultra poverty. And we have to learn from the strategies that have worked. And while we are learning, it is imperative for us in this room to stay focused on ultra poverty, keep talking about it, so that more and more actors come into the ecosystem. So I first turn to the champions, as I like to call, for the cause of ultra poverty. And I especially want first Mr. Kunal Sharma to come here and give us an overview of ultra poverty and a particular strategy that has worked in the past, and walk us through this for the next 10 minutes.
I'd like to begin by thanking John and the Nudge Institute for inviting me here. And it's my privilege on behalf of JPAL to be presenting today on the graduation approach. This is something that JPAL has, in a nutshell, the graduation approach is a program that over the last 2 decades has been rolled out targeting the ultra poor. It's a multifaceted livelihoods program that is designed to really help them over a 24-month period to graduate out of ultra poverty, to get out of extreme poverty. And so JPAL has evaluated these programs. I'll be presenting some of those findings, as well as at this stage, we are also helping, as I'll speak about, governments and others with designing and scaling up some of the graduation approach. So I'll be sharing some of that insights with you as well. So in terms of anyone who may not be familiar with JPAL, the Abdul Latif Jameel Poverty Action Lab, we were formed about 20 years ago. We're headquartered in MIT in the US, and we have a network of close to 600 researchers that essentially work on problems related to poverty alleviation. We have regional offices in South Asia, which is what I belong to, but we also in Africa, Latin America, and other regions. Our mission really is to reduce poverty, and we do so through informing policy, through scientific evidence, and which we generate through research, and then also converting research into action through policy outreach and capacity building. So we like to take a scientific approach to the problem in terms of innovating, testing, and scaling up of solutions. We do so primarily through conducting what we call randomized controlled trials, and essentially to test the effectiveness and to understand the causality of interventions that are being tried out. So what you'll see on the screen there is that JPAL-affiliated researchers have conducted over 1,000 RCTs across the globe in 84 countries. Close to 200 of them happen to be in India, and we work across a large number of sectors, which include agriculture, education, and health as well. So coming to the problem at hand, as I mentioned, the graduation approach is designed to help the ultra-poor move out of extreme poverty, to graduate out of it. But the problem of extreme poverty still continues to persist today. And just to kind of put some numbers up there, people, as per the World Bank, the definition for people that are living in extreme poverty is based on those that are surviving on less than $1.90 a day. This number is going to change fairly soon. I think it's going to go up to $2.15. If you think about SDGs, then SDG goal 1 is no poverty, to end poverty in all its forms everywhere. And target 1.1 actually is focused on extreme poverty, which is to eradicate extreme poverty for all people by 2030. So in terms of the importance of the challenge or the problem or this, that we're looking at here, you can't understate its importance. Now, as has already been mentioned, India has made significant progress in recent years, over the last 2 decades. There are different estimates. Data is a problem, but there are some varying estimates out there based on working papers, recent working papers, but a recent World Bank working paper puts the number at about 10.2%. That's the highest estimate that's out there for 2019 right now for India. Now, ultra-poor is a subgroup of the of extreme poverty or extremely poor. Now, what defines that demographic group is that they really are unable to meet their basic consumption needs. They're typically engaged in insecure occupations, do not have like a regular stream of income. They lack capital, skills, and confidence, essentially. And so essentially, they're facing both multiple and simultaneous deprivations in meeting essential human needs, and that's causing them to remain trapped in poverty. I want to recognize the multidimensional poverty index that the Niti Aayog recently has released. As per that index, around 25% of the country's population is termed as multidimensionally poor, and the largest number are in Bihar, which is above or 50%. The map shows you kind of the gradation across the country. So this is, again, just to reflect that there are multiple dimensions to poverty. What I want to convey on this slide is that that there are gradations, and the ultra-poor happen to be a subgroup of the extreme poor. The graduation approach is designed to take them out of extreme poverty. But the other point I want to make is that many of the mainstream traditional kind of government programs actually either don't reach the ultra-poor or they're not able to access them. they may need to have a certain amount of finance at hand or financial literacy, and so they may not have that. An example being that ultra-poor women in some cases may not be able to actively participate in self-help groups because they can't meet the required 5 to 10 rupees of savings that's needed. So coming to the solution, which is the graduation approach, this was first developed in Bangladesh by BRAC, a nonprofit organization there in 2002. It's since been replicated in several countries around the world, even in India as well, and evaluated across the world as well. So this is a big push intervention. Given the multi-dimensional challenges being faced, what's proposed or what the program consists of is, over a period of 24 months, help the ultra-poor graduate out of extreme poverty. So it blends together elements of livelihoods, social safety nets, financial inclusion, and social integration. And it's providing multidimensional support, so addressing immediate needs through, say, the provision of stipends to support consumption, as well as long-term investments in the form of technical skills training and enterprise development. So it's holistic from that perspective. And the idea is to move the ultra-poor who are really reliant on kind of inconsistent kind of income streams into self-employment where they're able to generate, which turns out to be a viable alternative for them, generating a regular income stream. And so it's a 24-month program. I just want to quickly run through the specifics for those that may not be familiar. There is a targeting process where you select the ultra-poor. You have to make sure that you're targeting the right people. You typically hand out a productive asset to the ultra-poor in the program, where it may be livestock, goats or chickens, or supplies for running a petty trade. They are then provided technical training, how to manage those assets and to use it for income generation. They're provided consumption support through stipends. It could be a weekly or a monthly payment. Home visits by frontline workers who are kind of coaching and guiding them on a regular basis. Savings support through opening of saving accounts, as well as provision of information on health and health access. So what's the evidence? This was tried in Bangladesh, 2002. It's been rolled out in other countries around the world. What you're seeing in the map is results from a paper that was published in 2015 by Professor Abhijit Banerjee and others in Science. It presents results from 7 countries. The countries are marked there: India, Bangladesh, Pakistan included, a few in Africa, and then Latin America and the Caribbean as well. And what they found is that those groups that received were part of the graduation program, they were able to increase their consumption by 6.5% compared to the comparison group. And they found that this approach essentially delivers lasting results as well. So it's been evaluated subsequently as well, 5 years later, 8 years later, as the graph shows on the right. The right graph is from the study in India. And even after, for example, 8 years, you see 8 years after the program ended, you see a distinct gap between those in green that were part of the program and those in red that weren't. And so long-run benefits they found of the graduation approach outweighs the costs. And again, looking at 6 of the countries, excluding Honduras because they had some disease issues with the livestock, the cost benefit ranges from, the benefits exceed the cost by 133 to 433%. The 433 number actually happens to be for India. And that's why you see on the graph on the right some large numbers. And basically, it's improvement through the shift from kind of menial labor to stable self-employment. That is the reason why you're seeing these changes. And as I mentioned, even after 10 years, you see that these gains continue to persist. So in terms of differing context, being countries or differing implementing organization, what this research shows is that it has delivered results. Just dwelling a bit more on India, again, looking at different facets like adults not having to go without meals, time spent productively, perception of economic security and consumption gains. All of them, the group that received or were part of the program fare much better than the comparison group. And the reasons for that are the diversification of income. This particular program and the results are for the first study that was done here. The program was rolled out by Bandhan Konigar in West Bengal, and Professor Abhijit Banerjee and Esther Duflo were the ones that were conducting the evaluation. It also found that those that migrated from the program for employment elsewhere tended to travel further away even and were away for longer periods of time, which actually translated into the higher income. So those were the results. So the evidence points that the graduation approach delivers results. So that was 2015. Since then, in a lot of countries, including India, a lot of organizations have been taking this to many states. Bandhan has taken it to, I think, 10 plus states in India. But I want to talk about just quickly one scaling example. The West Bengal study was 10,000 households. Bihar in 2018 decided that based on the findings, they want to roll this out in 100,000 households. So that's a scale up. And so this was in 2018 where they put in a budget outlay of 840 crores. For the program, which is to reach 125,000 households in 38 districts of the state. Now, when you scale it up, of course, the model needs to change. And so in this case, instead of Bandhan being the implementer, it actually became the state government through their state rural livelihoods mission, Jivika, being the one that was implementing. I'll talk about some of the innovations that were needed. Bandhan moved to a technical support role, and then JPAL continued in a evidence generation and process monitoring evaluation role. So that's how that program is set up. And I won't go through this slide in its entirety in the interest of time, but the key point I want to make is that it's important to take into account the contextualization and adaptation when you are moving from one geography to the other, and when you are scaling as well. So here, as I mentioned, it's the state government. So what they did is that they have actually recruited master resource persons, about 4,000 of them, which will be the frontline workers, each look after about 30 to 40 households. The village organizations were made to be a lot more involved in terms of selection of enterprises that would be that the ultra poor would be taking up, targeting of the ultra poor, and also building community buy-in. So I can't stress this point enough. I mean, a lot of detailed work was done in mapping how each stage of the graduation program, the circles that you saw in an earlier slide where you have those 6 different interventions, as to how they could be mapped when you're scaling up. And so where Bihar is today, 140,000 households have been identified. 25,000 have graduated. There are certain criteria that they must meet. Another 20,000 households will graduate by September 2020. Just my final slide in terms of wrapping up. So I think based on what I presented, hopefully people agree that there is great potential in terms of the scale-up of the graduation approach. Across India, the graduation approach has reached about 290,000 beneficiaries. The Jivika program and Bandhan Konigar have done most of those numbers, but the nudge is also involved, as are some other institutions. So there are institutions getting into this and looking at this program. Globally, more than 100 organizations have adapted the approach in 50 different countries, and nearly 14 million people have been reached. I think the Bihar example provides a kind of the case for other SRLMs to really look at this program and to think about rapidly scaling it up. And then finally, in terms of how can you best set this up, I think a collective effort on the part of government, funding organization, knowledge partners, and implementing agencies, given the adaptation requirements, the different pieces to it, I think it would really benefit from it. Thank you.
Thank you, Kunal, for walking us through the definition of, or at least how do we differentiate ultra poor from the other extreme poor and the poor. Let me now come to the panelists, and we'll be discussing 3 topics today. One key topic will be how do we identify ultra poor. So we've spoken about different categorizations, but at scale, and if if we want to target them through such programs that Kunal just spoke about, then how do we define them very clearly? How do we put a finger on the household and say this is an ultra poor household and this household should receive XYZ benefits? And that's a huge challenge. We'll talk about that. We'll also talk about the approaches that have worked so far. We have experiences from across India and across the world on the panel here. And we'll also talk about opportunities to collaborate. I'll first come to Jayaji, to you. From your vantage point, from the Ministry of Tribal Affairs' vantage point, what approach have you taken to identifying the poorest of the poor and targeting them through schemes, programs of the Ministry of Tribal Affairs?
Thank you, John, for bringing the tribal communities first onto the stage, if I may say so. The tribal communities number about 700 and odd if they are scheduled, but there are many more communities which we call tribal, though they may not be all scheduled because of various reasons. Identifying the ultra poor, one of the things that has been done in the Ministry of Tribal Affairs is that there is a category of tribals whom we call the particularly vulnerable tribal groups. So the PVTGs, as we call them, they used to be called primitive tribes at an earlier time. The word primitive is, of course, not a very acceptable term. So we now call them the particularly vulnerable tribal groups. And the characteristics that these PVTGs have is very classic ultra poor. They are very remote. They have a technology which is pre-agriculture technology. They may be doing agriculture. They may be cultivating the land, but then the kind of techniques they use are more or less what we call pre-agriculture techniques. They may just throw these seeds and then whatever plants come up. They may not have implements that are really, used even in agricultural, non-technological agricultural groups, the kind of implements that are used. So that is another one. They have, of course, a distinctive culture, but their remoteness makes it very difficult for us to kind of have those interventions. So the ministry has a scheme, it is a gap-filling scheme, but the ministry has a scheme which is dedicated to PVTG development. We call it the comprehensive development scheme for the PVTGs, but it's a small budget scheme. These PVTGs would number, kind of in 2 digits sometimes, 46, like the Andaman tribals, 100, 46, 56, that kind of a number, to about a few lakhs, say about 3 to 4 lakhs each group. So totally we have about, I think, 25 lakh or so PVTGs in the entire country, and they would probably, in my opinion, actually fit this definition of ultra poor. You see, in a time when things were not as developed in terms of, the forests were there, they had a habitat. So there was a kind of life they used to lead that was untouched by the rest of the society, rest of the country. But as we start, going into the forest areas, as we start claiming the forests, the minerals, the mining goes on, transport and communication networks get established in their what we call the habitat area. So all these are affecting the PVTGs also. Obviously they are affecting the PVTGs, and their old lifestyle has been kind of disrupted completely. But a new lifestyle has not been able to give them what they really require. So I wouldn't use the word mainstreaming, but then they're coming into their own and claiming their voice in the scheme of things is probably not there. So they fit this definition of the ultra poor very, very snugly, if I may say so. And the program that we have is one attempt to ensure that they are able to find facilities like schooling, Anganwadis. There are also some livelihood opportunities, but then they are not I mean, they are state-driven schemes. So the states have their own micro-project areas. They set up micro-projects where they then do a need analysis and throw back schemes to us, for the project appraisal committee to approve. So this kind of approach is one, it is community based, not really individual household based, unless it's a beneficiary scheme. So to that extent, identifying the ultra poor, when we talk about identifying the ultra poor, I think the PVTGs as a group would be a very fit community for this purpose. But I would also add that our own scheduled tribes, the larger group of scheduled tribes, which number more than 10 crore in this country, I think some of them would also fit this definition. Especially in the central Indian belt, some of them would fit this definition. Personally, the way I think we have to look at the identification is, we know that there are the districts, there are the blocks, there are the taluks. The administrative structure is very well defined. And with the NRLM and the forest, because most of our tribal population is also, when you look at the forest map of India and the tribal map of India, they kind of, overlap. So we will need to look at ways in which this tribal group is, where is it residing? What are the kind of facilities it has? What is the kind of household it has? So that kind of a micro level mapping, I think, is very, very essential in terms of households. So to that extent, I think when we talk about identification, we need to leverage technology, we need to leverage our local state administration. Neeta has worked in the field, I have worked in the field. So we know that there is, for every village there is a patwari. And in every village we know who are the people who are in, who are the people who are out. And the census data does throw up. So we will have to do this identification in a manner where our inputs go to those people. So I think for the purpose of identification, I would say we must look at those kind of aspects.
Thank you so much, ma'am. You rightly touched upon the need to micro map, as you put it, and micro mapping, the use of technology, the use of district administration. You called out the role of NRLM there, and also recognizing that beyond PVTGs there will be ultra poor amongst the scheduled tribes as well, and to be able to identify them, we need to work together. Thank you so much for those points. With that, I'll actually come to Neeta ji, because we have spoken even during this panel session multiple times about the role of the day NRLM and the community institutions. Neeta ma'am, how do you look at defining ultra poverty? This is an exercise at this point in time to be able to target them effectively, and what are the opportunities that DNRLM's mandate with the community institution presents?
Thank you, John, and thank you for inviting me here on this platform. So I think, in the interest of time, you raised a few issues about identification, strategy and all. So I'll try to address all maybe together. And I'll try to address it from the point of view of the Ministry of Rural Development as well as NRLM program. So I think the first thing here is to try to recognize this issue, this problem, that there is ultra poverty and there are ultra poor people here. And not only for the Ministry of Rural Development to recognize it, but the Government of India, all the development sector ministries, to be able to recognize this whole concept of ultra poverty, and that there is a need to have a special strategy for addressing this issue. So towards that, I think we need to take an initiative first of all. And then comes the issue of trying to define ultra poverty. As you said, how do we define ultra poverty? And there, I think everyone has talked about the SECC database that we have. Though it is a little dated now because it was done in 2011, and we need to really account for the population increase and many people leaving, etc. But it definitely gives us some good database, because here again it's not only an income based thing, it talks about the multiple deprivations that a household may face, and all the households are ranked on the basis of the deprivations they may be facing. So there also we have an opportunity to look at which are the deprivations that would really, define the ultra poor houses and take those indicators. In fact, we had one committee earlier set up under an ex-secretary in Government of India, Mr. Sumit Bose, and he had recommended certain deprivations to be included, like D3, D5, D7, like women-headed households with no adults, or households with managing with wage labor, etc. So that could be one way of shortlisting. But the advantage we have in India, and particularly because of NRLM's huge outreach, is that we have community institutions all across the country, the rural poor women, and they have also been exposed to some kind of participatory identification process for identifying the poor. And having that background and that knowledge, I think we can definitely get these institutions to vet the finally identified households, so that we are able to actually identify the absolutely relevant, the target houses, the really ultra poor. And because these are the women from the local area, they sort of know which are the really ultra poor. And as everyone mentioned, in these ultra poor households are those that are not having any assets, they cannot even have 2 meals a day, despite all the social security being provided through PDS or all. They are not getting enough food to carry them through the whole month also. So the local community really knows that these are the households that are really poor, and they know they can do this participatory identification process also. So eventually, after using the databases that we have, the role of the community institutions would be important, and that is something that Bihar in the SGY project has also done. And then after doing this identification, I think there is a need for convergence between all the departments, and I do believe the graduation approach is a very good approach to go by, maybe a little customization to the Indian context, but the big push that we talk about under the graduation approach is something that definitely is required, some kind of asset grant transfer, and also some kind of subsistence assistance for a certain period of time to these households. But because we have these community institutions, eventually we can attempt to bring these households under the community institutions. And the whole process, we think, should be under the oversight of the community institutions, so that they own up, and then subsequently they are able to even carry this intervention forward even after we stop working directly with these households. Of course, we need to work for 2 to 3 years with each household, but after that the community institutions can take over, and they can also during the intervention do all the planning. And another thing that we definitely need is to have a good cadre of people who would be supporting these ultra poor households. So it's the community cadres as well as some professionals that we need to bring in here, and the community institutions, the cluster level federations, etc., can definitely provide the oversight that is required for this, even help in the livelihood planning. The asset transfers can happen through these community institutions. So definitely there is a very important role, I think, for the community institutions under NRLM to play here. And of course, as I said, we have to define the strategy, the graduation approach, and how do we give the big push, how do we give the subsistence assistance, what kind of convergences with other departments would be coming, because there are social security schemes. How do we ensure that all the entitlements are taken to these ultra poor households also? Once we are able to build this consensus between the different departments about the correct way of identifying these households, and then that convergence can really be brought into work with these households. And then, we have learnings from some projects that have already been going on. Of course, SJY is a large project in Bihar, but we are also trying to work with the Jharkhand State Rural Livelihood Promotion Society. Nudge is supporting us, so that's likely to throw some learning for us. We also have had some good work done in states like Kerala, Andhra Pradesh, with a lot of convergence happening and very structured kind of convergence happening by putting the community institutions at the center and all the different departments coming together to help out. Then going forward, I think we need to bring all the stakeholders on the same platform. We need to find a lot of partners. So that is where, when you talk about collaborative effort, we need to bring in partners from within India who have worked with the community-based institutions, with the very poor and vulnerable. The PVTG is definitely a very important component. So we have to bring in those kind of partners. We have to bring in the global experiences. I think we've had discussions with Anna and other BRAC also a little bit. So that kind of experience has to be brought in. A platform has to be created where we share all these experiences, and I'm sure India will also throw up a lot of learning. And then we need to have institutions that bring in technology. Because I think NRLM to a large extent has been able to professionalize rural development, but we need to bring in more and more technology for efficient monitoring, efficient service delivery, etc. And then, of course, customized livelihoods for these rural households, customized livelihood planning and activities. And last but not the least, definitely some innovative financing products, because we also have to get the financing institutions on board. There is a lot of confidence built amongst the financing organizations with NRLM and NRLM SAGs, but this is a very specific group with a lot of risk involved perhaps, and how do we make sure that we are able to finance these kind of institutions also? So with this whole gamut of things have to be really looked into, and we're trying to work now on that, and hopefully we'll be able to come out with all these kind of strategies very soon, and start really good work trying to cover all the ultra poor. Thank you.
Thank you, ma'am. Thank you so much, ma'am, for covering the entire gamut of identifying, targeting them, and collaborating. You touched upon very important points. Of course, the role of community institutions in identifying at the last mile, how the community institutions can really take ownership of the identification process. You also spoke about experiences from Kerala, Andhra Pradesh, and many other states, JSLPS, SJY as a program. The role of technology, but importantly, the role of a platform where experiences from across the world can come to India, that can help us target the ultra poor better and better. Lastly, you also touched upon innovative financing, also a very, very important topic, especially because of the kind of resources that will be required to target the ultra poor. It does take more time, more resources. So with that, I actually want to come to Anna and ask you, Anna, to comment on your understanding of approaches to define and target the ultra poor, because there could be an absolute definition of ultra poverty or a contextualized definition. Both serve very different needs. Both have to answer the question of how do we target, intervene, and how do we allocate resources in a resource constrained environment. How do you look at in this context, the question of defining ultra poverty and targeting them with the resources that we have available?
Thank you, and thanks so much for inviting me to be part of the discussion today. I'm quite honored to be sitting among some very esteemed colleagues here to discuss this very important topic. I think to echo maybe what Subrahmanyam sir said in the beginning, many poverty economists have already studied this topic largely to death on how to measure poverty, and I think Kunal from JPAL would probably be the best place to really put a good definition on it. But I think it's one of those things that maybe best to think about. You know it when you see it, and I think I think this is something the Additional Secretary Ma'am also referred to, that people know who the poor people are who are living in their community, and how do we leverage those kinds of community-based institutions. So that's one aspect. I mean, before maybe starting there, I think the second point to really note is that context matters. And who people who are poor in one context, maybe one measurement of poverty, whereas that measurement of poverty may not be the same. I think it's widely accepted that poverty is multidimensional, that there are a multitude ways that we can measure poverty, and people can be poor and deprived along a number of different dimensions. In working a little bit with the Ministry of Rural Development, we looked at some of the programs in India, and as my colleague highlighted to me, for example, in the state of Jharkhand, being a female-headed household would probably be a good indicator of being poor, whereas in Kerala, actually food insecurity is a good indicator of being poor. So what the indicator is of poverty really matters according to the context. In this way, I think, again, to come back to the point on community-based institutions and community institutions really being at the forefront of helping to identify who the poor people are. And here I want to look at a little bit, I'm not going to pretend to be an expert on India, but to draw a bit from some of the global examples. Actually, I think there was an interesting analysis done in the context of Indonesia, where they were looking at people identified as qualifying on a social registry based on a social registry list, and people who were identified as qualifying for a social protection program based on community-based targeting. And the analysis found, this was actually done by JPAL colleagues, Ben Olken and others in the context of Indonesia, and what this found was that even though the social, it found many things, but one interesting finding pertinent to this conversation is it found that people identified by the social registry list, maybe it was slightly more accurate in really pinpointing the people who were poor, but there was not much difference in terms of the people who were identified as poor by the community-based targeting method. And there was much higher social ownership over recognizing that these were the people who were deserving of the additional support that would come through the social programs. So again, that kind of activating the community-based organizations and identifying who they really know as being poor is, I think, a really critical piece in identifying who the poor are. I think there's maybe a second opportunity for India to be thinking about, and I caught only the tail end of the last panel, but there was a discussion on the value of data. And I think India has a lot of data, a lot of rich data, and there's opportunities and some global examples where they've used big data to try to also help to better identify and target certain poor populations. I'll point to two examples. The first is in China, which had a large-scale poverty eradication program, and just a few years ago declared the country as being free of poverty now. There's a 0% poverty rate. And how they got to that last mile poverty eradication was in part to use big data schemes to really pinpoint where the pockets of poverty were that remained, and then activating the local governments to basically say, you with your local resources, go out and figure out what it is about those people that holds them back, what is that multidimensional poverty trap that's holding people back, and then make sure that they get out of it. And in China, that system works. I'm not saying that you should cut and paste that system in a context like India, but in that particular context and institutional setup where local governments are highly incentivized to achieve KPIs, that worked well to eradicate poverty. Similarly, in Thailand, they've now introduced a new program where they're looking at not only the different data sources that are available to measure poverty, but how to integrate the different data systems and data sets so that you get a multidimensional. I think a multitude of departments are working on data. I think we've heard a number of different examples of data sets that exist in tribal welfare or in NRLM itself. Maybe thinking about how to integrate the different data sets and data systems, and then activating as a sort of a verification mechanism or a community-based or a village organizing verification system that would then probably give you a fairly accurate, there's always going to be some inclusion-exclusion error on that, but a relatively accurate depiction of what the local systems would consider to be poor, as well as some maybe better use of all of the different data systems and data sets to identify the poorer populations. So let me stop there. Thanks very much.
Thanks, Anna. Thanks for that. Do we have 5 more minutes? Okay. What we'll then do is maybe go a full round, take a minute each, talk specifically about a point that Kunal brought up in his slide, which is this is as big as a priority as anything else, because we've called this out as the #1 SDG goal: no poverty in all its forms, and in any of its forms everywhere. 1.1 specifically calls out no extreme poverty in any of its forms everywhere. So if I were to ask each of you, what's the one thing that India needs to do to get to this goal by 2030? One thing is a tough ask, but if I were to put you on the spot and ask you, what's that one thing that we need to do if you were to get together and get to the goal?
I would say, I'll also refer back to the previous panel, and I think there, one of the speakers, Vikrant Bhargav, said, when he started in philanthropy, he was not looking at the government at all, and then 10 years later, all his spending is going towards helping the government, supporting the government. So I think I will go back to the one of the points I had on my last slide, which is that if in India you want to solve this problem by the target date of 2030, the government has the biggest role to play. But there are other organizations, institutions that can play a supportive role. But I would say it really is the Indian government, the state governments that need to set up. Bihar has actually set the example. I think others can follow.
Thank you.
That was a tough one, John, and I will not answer in one word. I'll just take probably 2 minutes to just go through those 3 questions you asked.
Sure.
I thought you would do a round of all the 3 questions, so it was the first one that I talked about.
Sure.
But what I really feel is the ultra poor, what is most important, whether it is for ultra poor or for extreme poverty, is to avoid the debt trap and the poverty trap. That's something that is extremely, extremely important, and I think we need to look at generations here. And when we talk about generations, I would like to have a 2-pronged approach. The NRLM targets adult women. Now the adult women are, I would imagine, 25, 30 plus, and they go up to 60 plus, 60 at least. So it's an age group which is kind of okay, it needs to survive, it needs to do things. But I go back to what we were discussing, what exactly is the income augmentation, what exactly is the sustainable income that is going to protect them throughout. So I would look at a disaggregation of those in the ultra poor households through an age matrix and invest heavily into education of those below 20, especially those who are probably in their 8, 9 standard now, so that there is some kind of a livelihood opportunity for the younger generation in the next 4 to 5 years, say when they are between 18 to 23 or so, where they can actually migrate. Migration was a huge thing in what you presented, and where the opportunities for livelihood for the next generation leapfrogs into something very unimaginable for the present generation of adults. And once we do that, my whole take on this is that there are a plethora of livelihood opportunities that don't need to be bound to the village, that don't need to be bound to a region, that don't need to be, kind of isolated or dependent upon the today's adult population. So the demographic dividend that we are talking about is something we must invest in very, very heavily if we really need to jump frog into that kind of a scenario. And the livelihood opportunities, I will just take a little bit to illustrate some of them. Caregiving is a huge, huge industry. And we have not even touched a small aspect of it. And these are the communities, when we talk about the SCs, when we talk about the STs, STs are a very well-knit in the community, so they know how to help others, how to be a part of a caregiver. The SCs have been almost always, engaged in some kind of a service occupation or the other. So these should be our catchment areas for things like caregiving, for things like jobs which involve a lot of manual labor, or an input which is something that, they would be more willing to go in. And then there must be opportunity for them to move forward. Because once we do that, I think the income levels of the next generation, and that's only about 5 to 8 years now. By 2030, if we are able to have a skilled workforce amongst the people who are in that age group, I think we would have made that transference from this side to that side. So that is one take. And with this education, I would also like to point out that education is a positive reinforcement to go into an income augmentation and an empowerment aspect. In fact, teachers in tribal areas. Teachers, we haven't even looked at how many are our subject teachers who don't serve in tribal areas or in rural areas. What is the kind of deficiency we have? What are the kind of, tutors, mental health counselors, counselors in schools. There is so much that can be done if only we were to have that skill set. And I think in every single set, including in bureaucracy, including police people, we really don't have those ratios. We are all understaffed in almost all things. So I think we have a plethora of opportunities there. And the negative aspect of a health crisis, I think we should avoid it. So when we talk about health opportunities to be given, we must look at what is the infrastructure, what is the personnel, what is the preventive health, what is the kind of places where these people are living. So there's a regional dimension to it, to ultra poverty. We cannot say no to that. Slums, for instance, they are really places where diseases breed if they are not well looked after. So what is it that we are investing in? And here I would like to say that we must look at spending as an investment for the future. Rather than saying that I'm spending on health, I would simply say I'm investing in health. I would simply say I'm investing in education of the next generation. And therefore, the kind of freebies that we are talking about, the kind of investments we are talking about, I think will need to be tailored for it. If we were to do that, I think livelihoods would take care of themselves. In the meantime, of course, the adult population needs to survive, one. Two, it needs to rear the younger population. Obviously, there is a requirement for a scheme like an RLM, for a scheme where they all come together. There is a social empowerment. There is a coming together. My only difference with NITA would be on the community institutions. Complete reliance on community institutions in a highly divided rural sector of India is something I will simply not advocate. The bureaucracy is a very secular bureaucracy. To this day, it has to be caste agnostic. It has to be class agnostic. It is agnostic to whoever is what we call the beneficiary. The moment we give this right to the community institutions in India, I am not as sanguine, as hopeful as NITA is. So with that, I would like to simply say that we need to have some kind of a balance. I would not distrust the community entirely, but I would be very wary of the kind of divisions that rural India throws up from time to time. We may be able, and we must not lose sight of the fact that rural India is also highly divided caste-wise in terms of residences. So this residence may be homogeneous, this particular area may be homogeneous and may be throwing up a good SHG, but the moment we know that that same panchayat is going to have one more hamlet being serviced for something else, there are going to be divisions coming up and we may not get the best results. I'm sorry, this is a very contrarian kind of a view I am making, but I think we need to be very wary of this aspect. So thank you, Naj, for the opportunity. Thank you.
Thank you for taking the time out, first of all, to articulate your position on all the three topics. It's really, really good to hear you on that. You highlighted very creative approaches that we can take to targeting the ultra poor, from the caregiving industry to education. There are many, many opportunities that you said we should tap into. You also said spending on education and healthcare should be looked at as investment for the future, and if we do that, then livelihood should take care of themselves. A very interesting point of view, and of course have cautioned us on the reliance on community institutions. Ma'am, well taken. We'll keep that in mind definitely. Neetaji, over to you to talk about how do we get to the SDG goal in the next 10 years, and especially given that you also emphasize collaboration as what might take us there.
Yeah, so I agree with Jia ma'am. This is a tough question to answer, because all the things that I listed are things that India needs to do to get there. But yeah, so I would still go with my first point, which I made earlier, was that we need to build this consensus about the existence of ultra poor, the definition, etc., the need for convergence. So once I think we have this consensus amongst the ministries, then we can definitely bring about that convergence that is required to address this issue. And there's a lot besides that NRLM can do. I still have a lot of faith on the community institutions. So definitely, NRLM can take up the larger responsibility, but the convergence aspect is definitely very, very important. And of course, as ma'am says very correctly, it cannot be an over-reliance on community institutions. You always have to cross-check with data, and the bureaucracy is, of course, always there also.
Thank you, ma'am.
Thanks. So in an ideal world, if this were the #1 policy commitment of India, and they said this is the one thing we really want to do, I think one of the things that we would, we typically advise governments on in multi-sectoral, cross-sectoral types of interventions like this, is to focus on a whole-of-government approach. A whole-of-government approach is really needed because all of the different aspects, arms, programs of the government can be put to best use, and the clarity around the roles and responsibilities of each of these ministries to achieve key aspects of what it would take to move the needle on poverty would be very critical. A whole-of-government approach backed by a strategic vision on how to achieve poverty and how you would know when poverty reduction was eradicated, or poverty reduction was achieved, or poverty was completely eradicated. That vision would then clearly lay out who's part of this, how they would work, and what it would take across different levels of government to achieve those results. That kind of a platform also serves well to leverage other institutions, the private sector, philanthropic organizations, NGOs, civil society actors, because the vision is then clear. I think that's in an ideal world. So absent of that, what else could India be doing? I think here the top 3 ministries really with a key focus on the ultra poor are sitting here in the room. Subrahmanyam sir has left, but the Ministry of Social Justice, Tribal Welfare, and the Ministry of Rural Development. I think there's likely an issue that India would have to look at in terms of looking also at ultra poor among the urban population, and the fact that urban population is rising. But I think the easiest solution in terms of where to start is likely within these 3 ministries to get some kind, as Neeta ma'am is saying, to get some kind of consensus on how do we measure the ultra poor, identify them, and then how do we provide them the support infrastructure. How do we customize the approach? What more is needed? How do we build out the support systems for the particular poverty traps that these populations are facing? And then how do we roll that out? And I think the fact that all 3 of these ministries have significant, sort of social and human resource infrastructure that exists that can be leveraged already, and programs on the ground and investments in community institutions is a great starting point to begin to address the monumental topic of the ultra poor in India. Thanks.
Thanks, Anna. You've rightly sort of summarized by saying that the 3 ministries for whom ultra poverty is probably sort of the first thing, first area of concern, or first interest. are here or were here now on the panel, and coming together to work is a great start, as you've just highlighted. You also highlighted an ideal world approach, but I think it is a really good summary of how you look at getting to the SDG goal 1. With that, we come to the end of the panel discussion. Thank you so much to everyone for taking the time out, and thank you to everyone in the audience for being here and listening patiently as well. Really looking forward to people who are here, people on the stage, committing to ending ultra poverty and working together, and also coming together like many of us here highlighted, on a singular platform to be able to get to the goal in these next 10 years. Thank you so much for your time.